aren't real doctors. Oh, what would I say? Well, that's obviously false.
That's not true at all. Pathologists need to know just as much and then so much more than any doctor coming out of medical school.
Pathologists are absolutely real doctors. After a 4-year medical degree, or an MD, you become a resident, where you are a doctor training to be a specialist in pathology. We may look at patients in a slightly different way than a radiologist, a surgeon, or an internist, but we're using that complex clinical knowledge, that knowledge of patients, and applying it to our specific specialty to provide the absolute best care for our patients.
The interpretation of laboratory results definitely requires a lot of background education and to be able to relate that with the patients that we see on the bed. And sometimes we get consults that require some interaction with the patient or their managing team. And in fact, during my undergraduate years, I was taught that the pathologist is the doctor's doctor because you are positioned to guide and to counsel your colleagues on how to manage their patients. So we are certainly doctors, and it only takes someone who is at the same cerebral level with a colleague to be able to communicate in a language that they understand.
We need to understand all diseases and how they impact the human body. We need to understand trauma and how it impacts the human body. And we have to be able to apply what we learn, the huge amount of what we learn under the microscope and with all the tests we bring in. We need to be able to link that up with what we know is going on clinically with the patient. So yes, we are very much doctors.